Today I shall discuss about polycythemia. So what is the international definition of polycythemia? Polycythemia refers to an abnormally increased red blood cell mass in the body. And what are the international guidelines? Such as those from the World Health Organization use the following criteria. That is absolute erythrocytosis, true polycythemia. A true increase in RBC mass, usually 125% of predicted value for age and sex. Since RBC mass measurement is not routinely done, hemoglobin and hematocrit are used. Generally, in our country, 14.8 gram percent or gram per dl hemoglobin is considered as 100%. So if it is 125%, 125% or more, then it is called polycythemia. So WHO hemoglobin and hematocrit cutoffs widely used internationally. Men, hemoglobin greater than 16.5 gram per dl and hematocrit greater than 49%. That is normal is 45%. In case of women, hemoglobin greater than 16 gram per dl and hematocrit greater than 48%. Though polycythemia strictly denotes increase in all cell types of blood, traditionally it represents increase in number of red cells. So polycythemia basically increases all the cell types, that is platelets or WBCs, especially neutrophils, but traditionally it represents increase in number of red cells. Now about the primary polycythemia, that is called polycythemia rubra vera. Rubra is for red and vera comes from Latin meaning true or genuine. That is true polycythemia with redness, that is polycythemia rubra vera. Disease commonly starts in 6th decade of life, that is after 60 years, and usually presents with headache, plethora. Plethora means a ruddy complexion, pruritus, that means itching, thrombosis. Thrombosis, that means blood is clotted inside our vessels, it is clumped, and then it blocks some area inside the vessels, and also GI bleeding. For plethoric appearance of patients, the disease is also called polycythemia rubra vera. So this is the picture of facial plethora. Now bone marrow is characteristically hypercellular with involvement of all lineages, all types of cells, that is WBC lineage or platelet precursor cells, or are hypercellular. Erythrocyte count is usually very high and leukocytosis with absolute neutrophilia. So mainly neutrophil are increased in case of leukocytosis, and thrombocytosis, high platelet count are also common. And the disease is treated by phlebotomy. Phlebotomy means removal of about 500 ml of blood in 2 to 4 days time or 2 to 4 days interval by IV route. And myelosuppressive drugs like hydroxyurea and busulfan are also prescribed to inhibit marrow activity. Thank you, everybody.